I am Jon Robinson. I am the executive director of Cathy's House, which we are men's recovery housing located in Medina County. We have 28 beds total, a couple different properties. We have 2 level 2 houses and 1 level 1 house. I did not start in nonprofit. I did not dream of being an executive director of a nonprofit growing up. Believe it or not, I was a firefighter and paramedic and a flight paramedic in Central Ohio, and then also an EMS instructor. So I've gotten to do a little bit of education stuff. So when I found these opportunities, it's like, yeah, absolutely, I'd love to do some of this. I'm a lead reviewer for ORH, the lead peer reviewer thing, and then do these as requested. So today we're going to be talking about ensuring resident empowerment and leadership in recovery housing. I should also say I am a person in long-term recovery, which for me means that I've not used drugs or alcohol since April of 2011. And really, I think resident empowerment is one of, if not the most important things to me. I mean, it's really nice to have houses and to have a bunch of people in our program and to have all the data and all this stuff that we're doing these good things. But if we're not really empowering the people in our program, like what are we doing? So I think this all starts with like recovery housing works. And we have this really unique perspective that other people in treatment don't. But we also have to have a belief of healing, right? Like we have to believe that people can make it. We've experienced the losses, but we know it's possible. Like we have to have hope. If we don't have hope, how can we cultivate that in our own houses, in our own program? How can we expect others to have it if we don't? We see our residents under different conditions from what other medical and psych providers see, and we deal with them in a home. It's not in a hospital, not in a clinical facility. They're not coming into our office once a week. Like we see them, and I'm going to use the term guys for me, but I see these guys every day, like living their lives, the day-to-day stuff over a period of time. We see them when they're sick and well, and they're wide awake, tired, strong and vulnerable, positive, negative, and we can observe these characteristics which might lead to insights that other clinicians might not pick up on for a long period of time. For example, I had a resident once, he wanted to get a car, and he got a car once, and things just did not turn out well for him. And we got him where he needed to go, and he ended up coming back in our program, and he got together and he said, you know what, I know that if I get a car, I'm going to struggle. And we know that too. But on paper, right? Oh, wow, great, man, you're getting a car. This is so good, right? You're achieving those goals. And in other settings, you see a client or a resident say, oh, wow, yeah, this person's getting a car. But us in recovery housing know, like, hey, this could be dangerous, right? That's just one of the many realities that we see and that we learn about our residents. Many of us are peers who have lived experience with what they're experiencing as well. That also adds to this very unique perspective that we have. We can understand in a way that physicians and nurses and counselors might not be able to through means other than their training. That lived experience is important to organizations and the programs, especially like mine, because we talk as peers, we interact with residents as peers, not as patients or clients. I have to get up on my soapbox for a second. If you don't have personal lived experience in recovery from substance use disorder or alcoholism, and you're in recovery housing, get someone who does. I'm not saying you can't do it. I'm just saying get someone who does to be involved with your program at a high level. We believe in the person-based perspective, the disease model, that we want to continue to shift it back on our residents to take responsibility and ownership of their recovery And that is really effective when you have someone that is walking the recovery journey with them. So that is my, that's my disclaimer. This is the recovery-oriented system of care. If I slip and say return of spontaneous circulation, forgive me. ROSC is a big term in the American Heart Association, so I'll try my best. But this is it, right? Hope needs to be the foundation, and in the middle of the pyramid are the peers, and that empowerment is drawn from that spirit of hope. So it all kind of goes upwards, and the transmission of hope is where recovery grows. You know, we're big fans of Russell Brand. If you don't know who he is, he wrote a great book called Recovery, Freedom from Our Addictions. And in his book, he says, you know, the opposite of addiction is connection. And part of why recovery housing works so well is because of the peer support that is involved. It's a group of people. I always say it's a group of people that are on mission together to achieve a common goal. And that is really that's like the meat and potatoes of recovery housing. I had an individual on my waiting list. Their mother had reached out and said, hey, can you just send me your program so we can get it started while he's here at home? And I said, no, like that's not how it works. Like, sure, you can require meetings and have a curfew and stuff, but really why this all works is because of the group of people that live there. So with peer support, you know, that involves this interpersonal sharing of information and experiences. It's this practical hope or practical way to help. You know, we're not reading out of a book. We're showing this, hey, this is what's worked for me. This is what I've seen work for other people. And that's the support we provide. And then also it interacts in a way that enhances the emotional and social well-being of our residents. And I always think there's two different types of peer supporters, right? There's the professional peer supporters, the card carrying ones that have taken the OMOS certification. I am one of those individuals. Many of them will work for organizations and they do amazing work in recovery housing, in the jails, in the hospitals, in peer-led other organizations, one-on-one, drug courts, all of those things, right? Peers are becoming integrated in all aspects of this workforce, which is phenomenal. But there's also the community peers, which are, I think they're equally important, just in a different way, right? Everybody in our house provides peer support, whether they took the training or not. And I think that's the first part of empowering residents, is to say like, hey, like you get to give back right away, right? No matter how far down the scale we have gone, we've realized that we can use our stories to empower others, is really what that means. So in this peer relationship, you know, our residents are consumers and providers, which they immediately both get help and they give help and they both receive it at the same time. So that's a cool thing when you're in a group of peers, is that instantaneously anybody at any point could say something that helps another person, whether they've got 1 day sober or 1 year. You know, and AA really is created that basic framework of giving back to other people, to giving rides, to sponsorship, to all of those things. And then, you know, that addiction or the substance use disorder is viewed as the center of the relationships. And that's where we draw that common experience from. Also, you know, this is from What is a Social Model? I can send the link out to this article, but they did say that a positive, sober environment that encourages support for abstinence is crucial. This is just one of the many studies there that I pulled from the social model, and then empowering resident leaders. So again, it's that, hey, we are struggling with this together. This is how I've done it, and you know, I'm walking this journey with you. That's the approach. So I think that also comes down to saying like, hey, like you can speak from your experiences as well. And I know I said earlier, recovery housing works because it's a group of people on mission together. It is all about community. You know, there is no secret formula to recovery housing. The only way it works is if there are other people living there. If you just have one house, if you just have one person in your house, you're just a really crazy landlord, right? Like, you have to have a community both in the house and outside of the house surrounding the residents. I think that's also like part one of this empowerment, right? Is to show that there are other people out there using their experience, strength, and hope to give back to others. So we require recovery meeting attendance in our program because it's about getting out into that community and building that support network. It's great. We've got a lot of great guys in the house, but if the support network is only the staff in your program, it's only the other guys or women in the house, and things go wrong there, which things are going to go wrong, that can really be harmful for the resident if they don't have other people that they can go to. That is the number one reason why we require recovery meetings. It's all about community. There's no secret there. So here's I say these are questions with stupid answers, right? Who provides the best peer support in your housing program? It's your residents. Who are the most accessible peer supporters in your recovery house? It is the residents. Why? Because they live there, right? No one knows what that house is like except for them, not even the staff. And they provide that unique perspective, right? We can have PhDs and doctors of all sorts and types and research and study our program and make this amazing program, but still you have to have people in it. And we don't know what that's like from their perspective. I certainly don't know what it's like to live in my own recovery housing program. And that's why they are the absolute best supporters in your program, are the other people that live there. So we need to talk to them like that and remember that, right? We need to emphasize this knowledge gained through their recovery experience and show that, hey, this is a way that you can help other people. And again, it's a resident to resident, not between an individual resident and a professional caregiver. And we really need to show that as a way to help others. We've experienced so much shame and trauma in our active use. What if one of the best ways of healing is to use that darkness as a light for somebody else? And again, there's the fifth promise of Alcoholics Anonymous, which says that no matter how far down the scale we have gone, we will see how our experience can benefit others. We get a lot, I think, out where I'm at, we get a lot of the resident and professional caregiver. If the system is working, the professionals should be all around. I really hope that there are plenty of resources and that there's plenty of support in our community. There is, and we're grateful for that. But who knows what it's like to be in the machine more than the ones that are in it, and that's so important. So we cannot forget that as we're striving to empower our residents as leaders, we cannot forget that they are the most important people to our program. And it is so crucial to the social model of recovery housing. Without empowering residents to provide that organic support, we cannot effectively transmit the message of hope. If we don't create spaces where they can share their struggles and their successes, we really need to do that, right? It's all about transmitting this hope through empowering our peers. And that's what that recovery-oriented system of care is. And I hope that we've learned who the most important peers in our housing are yet. I have to ask myself the tough questions all the time. We spent all this time developing staff and training and all of these things. But what about our residents? Why don't we focus more on them? Why do we, and I struggle with it too. Without that empowering, we don't have the peers. And really that's what it's all about. So I really have to challenge myself a lot and say, hey, who else needs to be at the table here? And we really try and integrate a lot of our guys in our leadership to do that. So we are recovery housing professionals, right? And that is quite the job. I did not know what I was getting into when I started it. We do all sorts of different things. We are caretakers of property and vehicles and landscaping and business dealings, organizational growth and development. We care for ourselves, our families, our recovery community. We model effective behavior, controlled emotions, and rational thought. Any of you can do all of those things perfectly while working in recovery housing, please shoot me an email afterwards. That would be something that I need to learn. An effective way to lose respect is to lose your cool. I did it once and it's not good. I've learned, and that's what this is all about, right? I'm learning on this journey too. We need to model taking responsibility for our actions. So like, it is so okay to fail. And we need to show that, hey, we're going to use our fails and we're going to turn them around and make them a success, that we're going to learn from these opportunities, that we're going to grow from that. I have a great leadership coach, Michael King. He puts on a couple trainings each year, and he talks all about just taking responsibility, that fails are fails, feedback is feedback. We don't need to associate all of this other stuff to it. And if we can just own our failures, that again can empower other people to do the same. But with that, we are teachers and guides and mentors, and we have to ask questions. We can't just tell people what to do. And that's all about empowering other people to come to their own conclusion. I think that's one of the most important characteristics that we can have to empower other people, is the one of being the motivator, right? We have to motivate other people to come up with their own conclusions. We can't just read from a book. We can't just say, hey, this is the way you need to do it, right? We can explain, we can educate, but if we can motivate them to come up with the solution themselves, that's empowerment right there. We have to be confidants. Confidentiality is so important. One of the most effective ways to lose your credibility is to break that confidentiality. We have to develop trust with our residents, with our staff, with our other colleagues in our systems here. And as peers, like, we have to work our own programs too, right? We have to know what that is. We're advisors. We have to understand what we're talking about, helping in other areas of expertise. So there's just a lot, right? Where we do a lot of different things. We provide accountability and structure as the gatekeepers, right? Structure, support, rules, all of those things, policy development, planners, right? We have to plan so many things. I always say that the best way to meet someone where they're at is to be prepared to do so. So we do all of these things in recovery, in this recovery housing world, but how can we support our residents and introduce them to the resources that support recovery? I really think like the best way to do that is to understand what we are actually doing, right? We don't just put people in a house and throw drug tests at them. That is not what we do. I broke it down to these three things. These are my big things. We provide opportunity, accountability, and momentum. The number one thing is that we provide that opportunity, the opportunity to live a new life, to have a place people can call home, to search and obtain and maintain jobs, that opportunity for financial help, affordable living, to a clean, safe living environment with people who care. So many people have not had that opportunity in their lives. And that is number one for us, is that we just provide opportunities. I've been doing this for a few years, and if a lot of guys say, oh, you save lives, you saved my life, you saved my life. It's no, I just provided an opportunity for you. I just walked you up to the door and helped you open it. And really, like, that's what I believe. That's really all we do. We provide opportunity as our number one thing. The second thing is, though, is that there has to be some accountability to that opportunity. There has to be structure and support, because many have never experienced the opportunity that we provide, we have to have accountability to that. That's where the structure and the support comes from in this recovery housing world. And again, that is how we can empower other people, by holding them accountable to it. Last part, momentum. We have to keep going. We have to keep setting goals. We have to keep pushing forwards. That is so important for me to not just get stagnant, both as a person in recovery and as an operator of recovery housing. We have to keep going. And we need to keep challenging ourselves and other people. So we have to create opportunity for people to lead, especially the residents, right? Even the annoying ones. I said it, even the residents that you look at and like, oh my goodness, like here they are. They need to have an opportunity to lead too. So in our organization, everybody is a peer. Our resident coordinators are seen more as case managers. They are certified peer supporters. They do not live in our housing program, and they do a weekly check-in with our guys, and sometimes daily as well. Our house manager position is not the standard live-in position either. It's just someone that is below a resident coordinator that can help with drug tests and check-ins and whatnot. Our resident coordinators take care of all the recovery plans and goals and all of those types of things. Our house managers really manage the day-to-day operations, and they do not need to live in the housing program. But our resident leaders do, and there's I could probably give a whole other presentation on house managers and the difficulties and challenges with that. So we have made this resident leader position for guys who live in the housing program, and we all have this approach from different perspectives. So our resident leaders are non-staff, non-paid individuals, and they are just our go-to people in our house. They provide that other level of accountability. They assist in activities that we plan. They welcome the new person. They give tours to people who are interested. They can even conduct interviews for residents on our waiting list, and they are the first line of support in our house. Really, we have a great recovery community organization in town. It's just a few blocks from our house, Hope Recovery Community. We do have a waiting list. And so what we do say is for individuals that can make it there is like, hey, why don't you go up to Hope? And, if you go to this meeting at this time, one of our resident leaders will be there, and you can ask them all about our program, right? They are the ones that are going to have the best information and will probably explain it way better than I can. And so that's really what we like to do, is to get them involved in that. So again, we have to create this opportunity, and obviously we would love to see someone go from resident to resident leader to house manager to resident coordinator, and then to program manager. Like we would love to see that, because they have that unique experience. So we have to create those opportunities within the house. So with that, though, we have to do some trainings. It's important to keep the team involved of what's going on. Explaining why we do things is so important. Like I just said about why we go to recovery meetings. Like, we have to explain why. It's about community. It's about building a network. It's about finding other people, other places, other ideas, other thoughts, right? You can't just say go to a meeting a day, or go to 6 meetings a week, or okay, now you're going to 5. Like, why do we do that? So, and I think we have to be able to answer those questions with everything that we do, right? Why do we drug test? Right? We know that one, right? That's pretty simple. Why is there a peer support requirement? Why do people have to get jobs? And if we can answer those questions, that will help us motivate those residents and those resident leaders to come up with their own conclusions. Staff and residents, they are our biggest advocates for what we are doing. They are the ones that are out there. They are the ones that are in the house explaining to the people in your program of the changes and the rules and all this stuff. And if we're not explaining it to them, we are not giving them the tools to be empowered. You know, I feel like I just constantly say no all the time. I'm the no guy in our program. I've put a bunch of people underneath me that they can navigate the waters a little bit better. But I just feel like sometimes I just constantly say no, and you know, when I really stop and just like try and explain why things are in place, you see the light bulbs come on a little bit. I actually have to go and do that today after this, is explaining one of our rules, and it actually has to do with attending meetings, right? Why that is so important. And we have a in-house house manager and resident leader training. Obviously, we have a staff orientation, but our resident leaders and our house managers, whether they live in our program or not, they have to go through a in-house training for a couple of hours just to go through those things, and that's this official training. You know, we talk about what makes a great leader, who is a leader, what the expectations are, and then meeting people where they're at. You know, our trainings have a lot to do with talking to people and leadership than it does with reviewing our rules and our policies and all of that stuff, right? Because how you talk to people, how you can meet people where they're at, is way more important than understanding the system. That stuff is written down in a book that you can go read. What rule is what? We want to make sure that we're speaking to people effectively, and that we're understanding that everybody is a leader, how to talk to other people as leaders, and to really encourage and empower them to take ownership and responsibility for what they got. So we have regular house manager or resident leader meetings. I got to tell you, this is really, really tough for me to remember to do. I've got a great staff of people, but again, we have to include our resident leaders in it. And I got to tell you, it's really hard because it's not convenient, right? I kind of want to be done around 4 or 5 o'clock working in nonprofit and recovery housing world. I don't know if it's for anybody else, but that almost never happens. But my goal is like, I do this during the day, and then in the evenings, I'd like to be somewhat of a normal person. But our resident leaders, they work, they have schedules. Our residents are an IOP, or they're working a full-time job, or they're going to meetings, or they're doing this stuff. They're in and out. Some of them work first shift and second shift, and they start at 2 p.m. or they don't get home until 7 p.m. And so we have to go out of our way. So if you really want to empower other people in your program, like I said earlier, the best way to meet someone where they're at is to be prepared to do so. If you really want to empower other people, you're going to have to get uncomfortable and go out of your way to do it. So when we have these house manager or resident leader meetings, we do like to role play scenarios and discussions. We'll bring up some stuff from the past of previous resident interactions and issues, and challenge our rules and help them explain them a little bit better. And again, that invites them into this empowering, motivational time that they get to explain it back to us. And those discussions are so important. I always like to do it because I like to, number one, hear their perspective as a resident or as a resident leader in our program. But then also, I do like to interject. Obviously, I love to interject my own opinions, right? Whether they want to hear that or not. But then the opinions of my staff and our other support people, like, we get to really have this discussion, this open dialogue at the table of, hey, like, this is how I see it, right? And we can disagree, and it can be okay, right? It can be okay to disagree in these scenarios and in these discussions. In these regular meetings, right, we want to discuss our house events, our resident events, what's going on. We'd love to plan them as well. Our resident leaders are involved in planning group activities, whether that is something that is officially sponsored by us in our program that we pay for it, or whether they go and do it themselves, or they go bowling or play cornhole or whatever. But the biggest thing is that I need to ask questions, right? I need to stop talking and just listen. And the longer I do this, the less I want to talk and the more I want to listen. Like, the responsibility of all of this stuff is really making me listen a lot more. And it's just a beautiful time for my own personal growth. But I need to ask questions. I need to ask other people, number one, for but what their opinion is on things. Also talking about the major house and resident events, like, we have to debrief things that happen. We all have stuff that happens. There's always drama. Men's recovery housing, particularly, is drama filled, which is just a joy to deal with. But we have to debrief these things, right? And that's where we can have these open discussions and find those perspectives and ask the questions. Like, it's just about continuing that. Have an open discussion. Look for multiple perspectives as we debrief this stuff. Ask questions, and then plan it, not only special events, but plan for future events too. Of, okay, if this happens again, how would you handle it? What do you think is the most effective way to do so? Also, having those semi-regular meetings with your resident leaders, gives them a say in what's going on. And, like, if you have a really good idea come up from someone in the house, like, use it, right? People have challenged our rules and our program and our phases and all that stuff, and I want them to. I welcome it, right? I'm just one guy, and we're just a team of 4 people on staff, like, working on this stuff. So if someone has a good idea and they say, hey, can we do this instead? Like, absolutely. I'm going to change that policy. I'm going to credit them with that, and I'm going to involve them at that level, right? We can all contribute to many different layers of this. The other thing is like, we want to have an agenda for this stuff. We want to rotate our resident leaders through facilitating those meetings, right? So it's not just me sitting there talking and talking and talking. Again, I'm working on really talking less and listening more. So, I have plenty of opportunities to talk. Obviously, I'm doing that right now. I can talk in board meetings. I can do all those things. But, like, for this, like, I want someone else to lead. I want them to experience that, and we want everyone to do that equally. So we rotate the agenda around, help them come up with what the agenda should be, what needs to be discussed, what's going on in their respective locations. Have them bring up the topics, and then again ask the opinions on, okay, what's the best way to support each other through this. And then we also work their support roles into their recovery goals. So it's okay, not only I want to get the car, I want to get a job or whatever, but it's I want to work on my leadership skills, or there's a tough situation and I want to have a discussion with somebody, right? That's a goal. Those are so important. Those are things that are going to continue on, hopefully long after recovery housing. And then when appropriate, get them into the peer support training, right? You can do that on Zoom now. It's great. They can take the E-Based Academy classes. They can learn so much there. Find those leadership training seminars, videos, have a discussion, build it in. Like, hey, you're in this position not just because I want you to be in charge. I want you to grow as a leader. Also allow for that independent group activity planning. Number one for me, for Jon Robinson, is to get out of the way, right? As hard as it is for some of us, we need to let things unfold. If it's disorganized, let it be disorganized. It's okay. Debrief it after. Talk through what can be done next time. Take notes. Some people are dying for an opportunity to lead and to feel important. And we have a huge platform to allow that to happen. A lot of getting out of the way for me is dropping the perfectionism part and allowing things to fail in ways, because really I learn a lot from my failures. So you kind of have to just let things unfold and And that is empowerment, right? Is, hey, I'm going to hand this over to you. I'm going to let you roll with this. And whatever the outcome is, we're going to sit down and debrief it. And I want them to ask questions, and I'm going to ask them questions and all that stuff, right? Because then it's their idea, it's their plan, it's their stuff that they're doing. I need to get it out of the way of that stuff. So again, we have a great and a huge platform to allow other people to lead, and there are just really small ways that we can do that, right? So empowering people is, we have to speak to the leader in everyone. Everyone has value, even the annoying ones, right? We have to create opportunities for feedback, whether that's anonymous feedback or a feedback form where they put their name on. We send out a weekly self-assessment that everybody fills out, and they can provide us feedback on that anonymously if they would like to. We also have to understand for ourselves, that feedback is just feedback. So as we create this opportunity for feedback, we're going to get it. If I can't take someone's feedback, that's on me, right? But I need to create that opportunity for them to provide it. We don't need to assign any positive or negative stuff to feedback. It's just feedback. We can take responsibility for our successes and our failures. We can discuss our failures because we are human. But when we do succeed, we have to own it, right? Show what it's like to take ownership of success in a healthy way. We don't need to run around our parking lots beating our chests and doing all that stuff, but we can say, hey, like I contributed to this, and like it worked out well. We also have to do the same with our failures. I think in recovery, we talk so much about our failures and our character defects and our shortcomings and all of that stuff, and not enough of like what we've contributed, what we've brought to the table in a healthy way. I think a big takeaway though for me over the last year is feedback is just feedback, and I can just thank someone for their feedback, and I don't need to do anything else with it. If I'm struggling with it, I got people in my team, in my corner that can help me do that. So that all just goes to taking responsibility, and that's stuff that you can learn in a great leadership class. The buddy system, I've heard of this in other houses. We try. We got guys that work on all different schedules, so we really rely on our resident leaders to do this. But a new resident gets a buddy. For us, it's a resident leader, and it's hey, this is Jimmy, and Jimmy's a resident leader here, and he's going to walk you through the house and give you the tour and all that stuff, and really is involved in welcoming that new person. We really do try and share our recovery plans and goals. And we encourage them to share that in our house meetings. Again, it's empowering them to say, I am doing this. I have completed this. I got my license back. I got my car, right? We have to highlight those successes. So when I ask people, okay, hey, what's your goal for the week? It's also who can help you with those goals. Is there anyone in the house that can help you, not just the staff? And do you think you can share that you're either working on this goal or you completed this goal with everybody else, right? We have to have that hope that people are completing their goals, and lead through their own self-development, and really taking ownership of their successes is so important. We have to celebrate that. So we have a resident of the month. We send out with our last weekly self-assessment of the month. We send out a resident of the month, and they get just a little certificate. When they're nominated for resident of the month, we ask our guys to say, all right, who should be resident of the month and why? And on that certificate that they get is all of the reasons why they were chosen. And again, it's a pretty cool experience to have guys read that. And it's all anonymous, and we don't put other people's names on it, but hey, you're resident of the month because this, you shared your food with me when I didn't have any, you helped me get a ride to this place, you fixed my bike for me, all of those things. And so that's just something that we can do to empower people as well, is to have that feedback provided to them as well. Obviously, you got to celebrate birthdays, sobriety anniversaries. We have to do those types of things in our program. So, in summary, right, we have to transmit that message of hope. We have to draw on the experience as a way to help others. We have to show people that there is hope, and you can use what you've been through as a way to help other people and model that behavior. We speak to the leader and everyone, motivate towards developing their own conclusions, ask for feedback, and take responsibility. I think it's really important that we have conversations, not just business meetings. Most importantly, though, is we have to take care of ourselves. We cannot empower we can't empower residents as leaders if we're not taking care of ourselves and working on our own program, whether that's a recovery program or some sort of self-development or leadership development. We have to take care of ourselves, and a lot of that comes from getting a mentor of some way, shape, or form. Value that confidentiality, and then take deep breaths. That's one of those things that I've had to do a lot in this is get a mentor, get several mentors, and take deep breaths. That is really all I got. I know the chat is open for questions if you got them. If not, the email will come out. I think Jon will pop in a minute and explain the email for the survey.
Yeah. Hey, Jon, if somebody's in recovery, but they wanted to do some more training, do you have any suggestions where someone can advance their
Yeah,
thinking?
yeah. So I mean, the peer support training through OMAS is a really great one to take, whether people want to become peer supporters or not. I see a lot of people like, oh, I don't want to have a caseload, so I don't want to take the course. And it's like, well, it's you don't just like all of a sudden take the class and then you become a peer supporter with a caseload, right? It's really good for how to discuss things, how to have conversations, how to ask the right questions, talk about multiple pathways. I really like that peer support training through the state because it kind of opens it up of how to really talk to people is really what it comes down to. That, and then Ohio Recovery Housing, right?
Of course. We got a question from George. How do you empower residents who are contemplating leaving unscheduled and or returning to use?
Yeah, so I think the thing is like when someone wants to leave for us, and I guess that can be a whole different conversation. There was unscheduled leaving. I think it's just like, hey, like we're still here to support you, right? We have to ask those questions. Hey, where are you going? Is this really a good place for you to go? If they're not going to have that and they say, you know what, I'm out of here, then you know what? Okay, like I'm going to empower you to make this decision. It's one of those things we just have to continue to walk alongside people. I have to really hold my own personal opinions and beliefs out of it a lot of the times and just say, hey, like I'm going to meet this person where they're at. They don't want to live here anymore. And that is okay for them to do. I think I always ask like, hey, can I provide you some feedback right now? And if they say yes, then I say, hey, I really just don't think this is a great time for you to leave. Like it's number one, it's expensive out there. This you've been brought up in this environment, right? We can go through all of those things, but if they say no, I'm not interested in your opinion, then I just shut up and let them go. And I know it's tough. But we'll have to let people work their own program and go on this journey.
What about if they leave and then they're now back wanting to come back to the house? How do you handle that?
Yeah, I mean, we see that quite a bit. I think it's about taking, you know, when somebody comes back in, it looks a little bit different for them in our program. We really want to know what the conditions were for why they left, what happened, if they left on good terms and they maintained their recovery journey, if they had a return to use. You know, we want to talk about all of those things. I think it's just about having those conversations with that. I also, when people want to come back, I also make sure that they are taking responsibility for their recovery, right? You don't just get to leave, go down the street, use, and then come right back in. Like, that's not how this works. Like, we really want to see that they're going to take responsibility for that. We need to see that there's some willingness that they're going to attend meetings or IOP or go back to treatment or all of those things. And really that empowers them in a sense of saying, hey, like, you got to take responsibility for this. You got to do some work on this in order to come back. It's not this free ride of, yeah, you just get to leave and do whatever you want and then come. That's not how it works.
Yeah. So it's about 10 till 11. I've placed in chat the OMOS peer supporters welcome page, so anybody wants to link onto that. There's also a forms link, a post education training survey. I'll be sending everybody out an email with that link. So, because once the webinar closes, you know, it's gone. But I'll be reaching out to everybody. And last call for questions. Describe the difference between being a resident leader and a peer support service provider.
Well, for us, a resident leader is someone who lives in our house. So they are one of our residents. Normally they've been there for at least 3 months. They have to be in our, what we call phase 2. So they've completed their first 3 months. A peer support service provider, a peer recovery specialist, that would be someone that is, for us, what we see is someone on the outside that works for another behavioral health organization that can provide additional services outside of the house. However, our resident leaders are able to go and take the peer support training whenever they like. So they technically could be certified as a peer supporter in their resident leader position. It's just about how they approach things. So obviously they would not have a like clinical caseload of people who lived in the house. Normally in this area, they won't get hired as peer supporters until they have at least a year plus of recovery time, which means they're in one of our level 1 houses already. But I think resident leader is, hey, you're doing a great job. I want to empower you and give you some opportunity here to lead and to help us in our program. And that's what that is. Peer support from a service provider is going to be an outside resource for everybody in the program.